Today we're going to talk about what a consultation is all about. Oftentimes, your imagination with a consultation is probably pretty straightforward. You come in, you have a little checkboard, and you go, okay, these are the things that I want the doctor to do, 1, 2, 3, 4, 5. The doctor says, yes, I can do A, no, I can't do B, let's do C, that sounds perfect. You go back, either get a little injectable, or you plan for surgery, and boom, it's done. Here's the difference. Remember one simple thing. As much as I don't know anything about the law, I don't know anything about engineering, and if you're an engineer, I'm sure you could sit there and talk to me about everything about engineering. I would be, not even understand it. But what's really important is I understand the face. I understand the face well from a technical standpoint as well as an aesthetic standpoint. So what's so important is a word called fiduciary. And what that simply means is, as a professional that's trained with a good eye, that I'm here to give you my best through an educated opinion. So that fiduciary responsibility means not just listening to your laundry list, but also listening to your concerns, but then giving you oftentimes what's more important from what I see to achieve what I call a wow effect, so you actually have a benefit. And there's two real goals, if I can boil it down for you, for what I try to achieve for you and with you during a consultation. Those words are education and trust. So a lot of times your word is treatment and a laundry list. My goal is to really get you to the point where I can improve you, and the money you spend with me is going to be worth it. Not just money that you throw at me, but money that you spend and you've invested in your face in a way that's worthwhile, both in terms of short-term and long-term. Let's talk a little bit about what I'm talking about education. First of all, as I said, you may come in with your clipboard and go, here's the things that I want, A, B, C, D, E. Let's see if the doctor can address each of them. Oftentimes the problem is that the questions you have will give me a clue as what bothers you, but oftentimes it may not be the most important things. Let me give you a couple incidences to have you better understand what I'm talking about. First of all, let's talk about the aging face, which is probably the most complex. A lot of times when you come through, your laundry list is wrinkles, gravity, folds, creases, asymmetry. But the vocabulary oftentimes that can be more important for you are convexity, uniformity, balance, and proportion. And you go, well, what does that mean? Well, obviously that's part of what a consultation with me is going to help you with. But what I'm trying to have you understand is oftentimes the vocabulary you have when you walk through to me is already so limited that I can't even begin to introduce a new concept until we get rid of the old one. So my goal is to educate you on the new ideas of what I can do for you. So that's extremely important as education. For example, I'll give you a couple more examples about education. A lot of people come in for Botox for the quick fix. They said it's easy, it takes 5 minutes, it's a lunchtime procedure, it's to make myself look better for a Christmas party. But what the doctor hasn't done is, and really failed to do, is educate the consumer, educate the patient about the long-term effects. That's right, the long-term benefits of shutting down wrinkles, letting the skin heal. Well then, if you don't have that level of education, you just come through and you sit in my chair, I hate to say, like an idiot. Because I want an educated consumer, and without my educating you, you really don't know what you're doing. You're sitting there really like an idiot. My goal is that you're an educated consumer. So education is so fundamental. I had another lady, an Iranian woman, that wanted her nose smaller. She said, she looked at this rule of thirds and rule of fifths. She said, have I heard about that? I said, yeah, of course I've heard about it. I had to take my board exams. I didn't know all those things. But do you think I ever used those? No. And the example in her nose, which is very interesting, is that the rule of fifths, when I looked at dividing the face into rule of fifths, if I had actually modified her nose shape to make it smaller to accommodate the rule of fifth, that is a fifth all the way across, her nose would have looked longer and would have looked less attractive. Well, so the problem is what you think you want oftentimes will actually impair your result. And that's when she asked me, do I use rule of thirds and fifths? I said, no. I look at a nose and I can see what it needs to have done. And that's really, really important that you understand, first of all, education, and that easily bridges me over to the next thing, which is trust. You need to trust me. You need to work with me so that you and I can establish a relationship. And that's really, in order to have a relationship, you have to have education and trust. I don't look at this as a short-term fix. I don't look at you as a patient that I expect you to be in and out my door and I never see again. I want to build a long-term relationship with you, which means I've got to provide ongoing education and ongoing trust. And trust means what I tell you is I'm not here to rip you off. In fact, I can tell you, and Stephanie, who's filming this for me, can tell you that I spend half the time telling patients what they don't need, what I don't want to do for them, because it's either silly in the sense that I'm wasting your money or I'm going to hurt you. So remember those elements about a consultation. So when you come in to talk to me for a consultation, I really want to get you a sense of what my objectives are with you.